Welcome back to the ECG series Part 3. In our journey of mastering ECG interpretation, we now arrive at one of the most challenging yet essential topics: cardiac axis and its determination. For many students and even experienced professionals, understanding cardiac axis can be a difficult concept. The various methods of axis determination often seem complex, and interpreting ECG leads correctly requires both theoretical knowledge and practical application. That's why, in this session, I have tried my best to simplify the concept of axis determination, breaking it down step by step. In this lesson, we will discuss what the cardiac axis is, why it matters clinically, and how to determine it using different methods. We will explore quadrant analysis, 3 lead methods, isoelectric lead analysis, and graphical method, along with their practical applications. By the end, we will apply these concepts to real ECG cases and important multiple-choice questions, ensuring you can confidently determine the axis in any ECG you encounter. Let's get started. Determination of cardiac axis, definition and clinical significance. Before we dive into the methods of axis determination, let's first understand what cardiac axis actually means. The cardiac axis represents the average direction of electrical depolarization in the ventricles. In simple terms, it shows us which direction the heart's electrical activity is flowing based on how the ventricles are activated during each heartbeat. Clinically, understanding the axis is crucial because axis deviation can provide valuable insights into underlying cardiac conditions. A normal axis suggests healthy ventricular conduction, while a deviation can indicate ventricular hypertrophy, bundle branch blocks, myocardial infarctions, or conduction abnormalities. This is why accurate axis determination is an essential skill for every clinician. Normal electrical axis. A normal electrical axis falls within the range of -30 degrees to +90 degrees. This means that the majority of electrical activity in the heart is directed downward and slightly leftward, as expected in a normal, healthy heart. When the axis deviates from this range, it is categorized as either left axis deviation, right axis deviation, and extreme axis deviation. Each deviation has distinct clinical implications, which we will discuss in detail. Methods of axis determination. Determining the cardiac axis from an ECG can be done using 2 primary methods. Quadrant method. The quadrant method is a quick and efficient way to determine whether the axis is normal or deviated. It involves analyzing the polarity of QRS complexes in leads 1 and AVF. If the QRS complex is positive in lead 1 and positive in lead AVF, the axis is normal. If the QRS complex is positive in lead 1 but negative in lead AVF, the axis is leftward, or LAD. If the QRS complex is negative in lead 1, but positive in lead AVF, the axis is rightward. If the QRS complex is negative in both lead 1 and AVF, the axis is extreme or indeterminate, or EAD. 3-lead method. The 3-lead method builds upon the quadrant method by incorporating lead 2 for additional precision. In this method, if lead 1 and lead 2 are both positive, the axis is normal. If lead 1 is positive but lead 2 is negative, it suggests LAD. If lead 1 is negative but lead 2 is positive, it suggests right axis deviation. These methods allow us to quickly classify axis deviation, helping us identify any underlying pathology. Isoelectric lead analysis. Another method for axis determination is the isoelectric lead analysis, which provides an even more precise calculation of the axis. The steps to perform this analysis are as follows. Find the lead with an isoelectric QRS complex. This is the lead where the R wave and S wave are of equal height. Locate the perpendicular lead to this isoelectric lead on the hexaxial reference system. Check the polarity of the perpendicular lead to determine the exact axis direction. This method is particularly useful when the axis falls on borderline values, and more precision is required. Left axis. Deviation. LAD. A left axis deviation occurs when the QRS axis is less than -30 degrees. Causes of LAD, left ventricular hypertrophy, left anterior fascicular block, inferior myocardial infarction. Clinical significance of LAD. LAD often indicates left ventricular overload or conduction delay, and may be seen in patients with hypertension, aortic stenosis, or conduction defects. Right axis deviation. A right axis deviation occurs when the QRS axis is greater than plus 90 degrees. Causes of right axis deviation: right ventricular hypertrophy, pulmonary hypertension, chronic obstructive pulmonary disease or COPD, left posterior fascicular block. Clinical significance of right axis deviation. Right axis deviation is often associated with right heart strain or lung disease and is commonly seen in patients with cor pulmonale or pulmonary embolism. Extreme axis deviation or EAD and indeterminate axis. An extreme axis deviation or indeterminate axis occurs when the QRS axis is between minus 90 degrees and plus minus 180 degrees. Causes of extreme axis deviation: ventricular tachycardia, severe conduction defects, artificial pacemakers, congenital heart abnormalities. This condition is uncommon and usual. Now that we have covered the fundamental concepts of cardiac axis determination, it's time to test your understanding through a series of multiple-choice questions or MCQs. These questions are carefully designed to reinforce key principles and help you apply theoretical knowledge to practical ECG interpretation. I encourage you to think through each question carefully before I reveal the correct answer and explanation. Let's begin. What is the cardiac axis? The correct answer is the average direction of ventricular depolarization. The cardiac axis represents the overall direction in which the heart's electrical impulses travel during ventricular depolarization. It is determined by assessing the QRS axis in limb leads. Understanding the axis helps in detecting underlying cardiac conditions such as hypertrophy, conduction defects, or myocardial infarction. What is the normal axis of the heart? The correct answer is between minus 30 degrees and plus 90 degrees. A normal cardiac axis falls within this range, indicating a well-balanced depolarization of both ventricles. Deviations beyond this range suggest conditions such as left axis deviation, right axis deviation, or extreme axis deviation, each of which has specific clinical implications. What is the term for an axis between minus 90 degrees and minus 180 degrees? The correct answer is left superior axis deviation. An axis between minus 90 degrees and minus 180 degrees is referred to as left superior axis deviation, which falls under the category of extreme axis deviation. This pattern is often seen in conditions such as ventricular tachycardia, artificial pacing, or severe conduction disturbances. What is moderate right axis deviation? The correct answer is an axis between plus 90 degree and plus 120 degree. Mild to moderate right axis deviation can occur in conditions such as right ventricular hypertrophy, pulmonary hypertension, or left posterior fascicular block. More significant deviations beyond plus 120 degrees suggest severe right heart pathology. What is moderate left axis deviation? The correct answer is an axis between minus 30 degrees and minus 45 degrees. Moderate left axis deviation is often seen in conditions such as left anterior fascicular block, hypertension, or early left ventricular hypertrophy. If the deviation extends beyond minus 45 degrees, it is referred to as marked left axis deviation, which may indicate more significant cardiac abnormalities. For the left axis deviation, which one is correct? The correct answer is positive in lead 1 and negative in lead 2. In left axis deviation, the QRS complex in lead 1 is positive, and in lead 2 is negative. This suggests that the heart's electrical vector is directed more leftward than normal. Left axis Deviation is commonly associated with conditions that cause left ventricular dominance, such as left ventricular hypertrophy, left anterior fascicular block, or inferior myocardial infarction. What would it suggest if lead 1 is more positive than lead 2 and lead 3 is negative? The correct answer is left axis deviation. A more positive QRS in lead 1 compared to lead 2 and a negative QRS in lead 3 suggests that the axis has shifted leftward. This is a typical finding in left axis deviation, often seen in left ventricular hypertrophy or conduction abnormalities. What is the most common cause of left axis deviation? The correct answer is left ventricular hypertrophy. LVH is the most frequent cause of left axis deviation due to the increased mass of the left ventricle, which leads to a dominant leftward electrical vector. Other possible causes include left anterior fascicular block and inferior myocardial infarction. What is the normal cardiac axis in pregnancy? The correct answer is left axis deviation. During pregnancy, the diaphragm is pushed upward due to the expanding uterus, which physically shifts the heart's position, leading to a mild left axis deviation. This is physiological and does not indicate any pathology. What conditions cause an axis deviation between -30 degrees and -90 degrees? The correct answer is left ventricular hypertrophy. A cardiac axis within this range suggests left axis deviation, commonly caused by LVH, left anterior fascicular block, or inferior myocardial infarction. Identifying the axis is essential for diagnosing the underlying cause. Which ECG change is least likely in a patient with a left pneumothorax? The correct answer is left axis deviation. A left pneumothorax pushes the heart rightward, leading to right axis deviation rather than left axis deviation. Other ECG changes associated with pneumothorax include T-wave inversions, low-voltage QRS, and electrical alternans. Now that we have worked through the multiple-choice questions, I encourage you to take a moment to revisit the methods of axis determination. Having a strong understanding of these methods is essential before we proceed to real ECG-based axis determination cases. When analyzing an ECG, always follow a structured approach. Ask yourself, is the axis normal or deviated? If deviated, is it left axis deviation, right axis deviation, or extreme axis deviation? What underlying conditions could explain the deviation? With these thoughts in mind, let's now dive deeper into the methods used for cardiac axis determination. Quadrant method. Quickly identify the axis or axis deviation. The quadrant method is a quick and reliable way to determine the cardiac axis by examining the QRS polarity in lead 1 and lead AVF. This method provides a broad classification of the axis and is highly useful in clinical practice. Steps to use the quadrant method. Examine lead 1 and examine lead AVF to interpret the quadrant where the axis lies. Positive QRS in both lead 1 and AVF. This indicates that the electrical activity is spreading in a normal direction. Positive QRS in lead 1, but negative QRS in lead AVF. Common causes include left ventricular hypertrophy or left anterior fascicular block, right axis deviation plus 90 degree to plus 180 degree, negative QRS in lead 1, but positive QRS in lead AVF. This suggests right ventricular hypertrophy, pulmonary hypertension, or left posterior fascicular block. Negative QRS in both lead 1 and lead AVF. This is rare and usually suggests ventricular rhythms, severe conduction abnormalities, or artificial pacemakers. Clinical significance of the quadrant method. The quadrant method is quick, efficient, and widely used in emergency and clinical settings. It is the first step in identifying abnormal axis deviations, but for more precise determination, additional methods such as the isoelectric lead method should be used. Isoelectric lead method, finding the perpendicular axis. While the quadrant method provides a general axis range, The isoelectric lead method allows us to determine the axis more precisely. This method relies on identifying the lead with the most isoelectric QRS complex, a lead where the positive and negative deflections are almost equal. Steps to use the isoelectric lead method. At first, find the lead with an isoelectric QRS complex. Identify the lead where the R wave and S wave are nearly equal in height, net amplitude close to zero. Now, determine the perpendicular lead. Once you have identified the isoelectric lead, locate the lead that is perpendicular to it on the hexaxial reference system. The heart's axis will be aligned either toward or opposite to this perpendicular lead. Determine the exact axis based on perpendicular lead polarity. If the perpendicular lead has a positive QRS complex, the axis is pointing in that direction. If the perpendicular lead has a negative QRS complex, the axis is pointing in the opposite direction. Clinical significance of the isoelectric lead method. This method is especially useful when the axis is borderline or unclear using the quadrant method. It allows for a more exact calculation of the cardiac axis, making it a preferred technique in detailed ECG interpretation. Let's explore another new method to calculate the QRS axis accurately. Precise calculation of the QRS axis using the graphical method. For an even more accurate measurement, the graphical method can be used. This technique involves plotting QRS deflections mathematically on a hexaxial reference system to determine the exact angle of the cardiac axis. Steps to use the graphical method. Deflection in lead 1 and AVF. Calculate the net amplitude of the QRS complex by subtracting the S wave depth from the R wave height in lead 1 and lead AVF. Then, plot the values on the hexaxial system. Draw these values on the respective axes of a hexaxial reference chart. Draw perpendicular lines from each point. Extend lines perpendicularly from each plotted point. The intersection of these lines determines the exact axis of the QRS complex. Clinical application of the graphical method. This method is highly precise and is especially useful in research settings, complex cases, or when ECG interpretation requires the most detailed analysis possible. Determination of axis. Case-based ECG questions. Now that we have covered the theoretical aspects of cardiac axis determination, it is time to apply our knowledge to real ECG cases. Understanding axis deviation in a practical setting requires careful analysis of the ECG leads, QRS polarity, and isoelectric leads to pinpoint the exact direction of ventricular depolarization. For each case, I will give you an ECG scenario to analyze it. Try to determine the axis yourself before I walk you through the explanation. This will help you develop confidence and accuracy in ECG interpretation. Case 1. You are given an ECG where lead 1 shows a positive QRS complex, while lead AVF also shows a positive QRS complex. What is the cardiac axis? To determine the axis, let's use the quadrant method. Step 1. Check lead 1. The QRS complex is positive in lead 1, meaning the axis is pointing to the left side of the heart. Step 2. Check lead AVF. The QRS complex is also positive in lead AVF, meaning the electrical impulse is directed downward toward the inferior leads. Step 3. Interpret the quadrant. A positive QRS in both lead 1 and lead AVF places the axis in the normal range. Final answer, normal axis. This ECG represents a normal QRS axis, commonly seen in healthy individuals with no significant conduction disturbances. Case 2. An ECG is presented with the following findings. Lead 1 has a positive QRS complex. Lead 2 is equiphasic. Lead AVF has a negative QRS complex. What is the cardiac axis and what could be the possible cause? Let's go step by step. Step 1. Check lead 1. Since the QRS complex is positive in lead 1, the axis is still pointing leftward. Step 2. Check lead AVF. The QRS complex is negative in lead AVF, meaning the electrical activity is moving upward rather than downward. Step 3. Interpret the quadrant. a positive QRS in lead 1 and a negative QRS in lead AVF, put the axis in the quadrant between 0 degrees and minus 90 degrees, that is, normal or LAD. Lead 2 is isoelectric, that is neither positive nor negative, indicating physiological LAD. Common causes of pathological LAD. Left ventricular. Hypertrophy increased. Left ventricular mass shifts the axis leftward. Left anterior fascicular block. A conduction abnormality that alters depolarization pathways. Inferior myocardial infarction, damage to the inferior wall of the heart may shift the axis due to scarring. Identifying left axis. Deviation is clinically important because it often suggests underlying left heart strain or conduction delays. Case 3. An ECG reveals lead 1 has a negative QRS complex. Lead AVF has a positive QRS complex. What is the axis, and what condition could be responsible for this finding? Using the quadrant method. Step 1. Check lead 1. The QRS complex is negative in lead 1, meaning the electrical impulse is directed toward the right side of the heart. Step 2. Check lead AVF. The QRS complex is positive in lead AVF, meaning the electrical activity is moving downward. Step 3. Interpret the quadrant. A negative QRS in lead 1 and a positive QRS in lead AVF places the axis in the right axis deviation range, which is between plus 90 degree and plus 180 degree. Final answer is right axis deviation. Common causes of right axis deviation. Right ventricular. Hypertrophy. An enlarged right ventricle causes a rightward shift in depolarization. Pulmonary hypertension. Increased pressure in the pulmonary arteries leads to right heart strain. Left posterior fascicular block. A conduction defect affecting the posterior fascicle of the left bundle branch. Chronic lung diseases, as like COPD, cor pulmonale. These conditions cause right ventricular overload and deviation. Right axis deviation often suggests pulmonary or right heart pathology, making it a key finding in conditions like pulmonary embolism or chronic lung disease. Case 4. An ECG shows lead 1 has a negative QRS complex. Lead AVF has a negative QRS complex. What does this indicate? Step 1. Check lead 1. The QRS complex is negative in lead 1, meaning the axis is directed toward the right. Step 2. Check lead AVF. The QRS complex is negative in lead AVF, meaning the electrical activity is moving superiorly instead of downward. Step 3. Interpret the quadrant. A negative QRS in both lead 1 and lead AVF places the axis in the extreme axis deviation range. So, the final answer is extreme axis deviation or EAD. Possible causes of EAD. Ventricular tachycardia and abnormal, rapid ventricular rhythm that can cause severe instability. Artificial pacemakers. Some pacemakers generate electrical impulses that result in extreme axis shifts. Severe conduction. Abnormalities, such as hyperkalemia. Induced changes or advanced heart disease. Extreme axis deviation is rare and often associated with serious cardiac pathology, requiring urgent clinical evaluation. Case 5. An ECG reveals lead 1 isoelectric, lead AVF positive. What is the precise cardiac axis? As lead 1 is isoelectric and lead AVF is positive. We know lead AVF is at right angles to lead 1, so the axis is in the direction of AVF, which makes it exactly plus 90 degree. This is referred to as a vertical axis and is seen in patients with emphysema who typically have a vertically orientated heart. By analyzing these cases, you have applied both quadrant and isoelectric lead methods to real ECGs. Practicing ECG-based questions is the best way to solidify your skills in axis determination. To continue improving, I encourage you to visit the posts section of this channel, where you will find additional MCQs and ECG cases for self-assessment. Thank you for joining this session, and stay tuned for the next part of the ECG series, where we will explore more advanced ECG topics. Thank you.